Well, good morning, everyone, and welcome to Health Talk, the Nassau University Medical Center on Hempstead Turnpike. I'm Dr. Victor Politi. I'm the president and CEO of NUMC, or NuHealth, and this is our bi-weekly radio show in which we bring in some interesting guests from around the county and in healthcare to talk to you and give you some insight into what's going on in healthcare and what's happening in that building on Hempstead Turnpike over there that you drive by all the time whenever you're driving down the street looking at it. And let me tell you, there's a lot going on in there, and it's really changing. And we'll be talking about some of the changes over the next half hour. But every other weekend, we have a special guest on and someone who can give some information regarding the services and just general healthcare tips and guidelines. And today's no different. We got a great guest today, someone who really has a far reach into the community, someone who's really making a real difference in people's health in the day to day here in Nassau County, and that's David Nemiroff. David's a vice president in the Nassau University Medical Center, and he's also the executive director for the federally qualified health system, the FQHCs, which are there are 5 of them right now located throughout the county that really provide a gamut of services to patients that live in those communities, basically all over Nassau County. So, David, welcome to the show. Thank you very much for taking time out of your busy day to come say hello to us and tell us a little bit about what you do. So why don't you start off by telling us about yourself?
Thank you, Dr. Politi. Thank you for having me.
Sure, David.
So I have been in the health and human industry for about 22 years. I have been the executive director for a little over a year at the Long Island Federally Qualified Health Center, co-operator with NuHealth and NUMC. It's been a great relationship. And my history professionally goes back to, I'm a social worker, but before I came to NuHealth, I ran an organization called the Mental Health Association of Nassau County. So my roots are in really nonprofits and community health and mental health, and really try to help a community to get all the needs and services to improve the health outcomes of our folks. And the FQHC is a wonderful opportunity, and the interaction with the hospital is amazing, where we can take somebody who's discharged from the hospital, work and support them in the community, and vice versa should the need arise. We offer a full range of services, and thanks to NuHealth, we were able to get federally qualified designation. And what that means is that as an organization, we get an enhanced rate of pay, which helps to support some of the high-need communities that we're in. And nationally, there are about 1,100 or so FQHCs that serve about, I think, 25 million individuals. And our FQHCs, as you had mentioned, are in Westbury and Hempstead, Elmont, Roosevelt, Freeport, and even the Roosevelt High School has a school-based health center. So we offer a full range of primary care. We also offer pediatrics, OB, GYN. All of our folks get to deliver in that beautiful new delivery suite over at the hospital. We have dentistry in 3 of our sites. Hopefully, come this spring, a 4th site in Westbury will have dentistry as well. Social work, behavioral health, podiatry, cardiology, optometry. Really a full range of complementary primary care services, to no offense, but prevent them from going to your emergency department.
Sure. And truthfully, that's what we really, I think, as physicians and medical providers, really want. We really want to get people before they come to the ER, before they have a catastrophic event. Control their blood pressure, control their diabetes, any types of screening, whether it's a colonoscopy for colon cancers or mammographies for breast exams. I mean, these things are so important to people to get to have performed so we can catch these diseases early. If we catch them early, we have a great chance of correcting it and having much better health outcomes. And you're out there in the trenches. You're our infantry. You've got these 5 primary care centers, beautiful facilities, state-of-the-art equipment, board-certified doctors and nurses, and you're out there for the community, and you'll take any insurance, you'll take all comers that come to your facility, you'll bring them there, and they'll get the finest of care. And that that is the mission. I mean, that's really what we all went into healthcare to do.
Agreed. The FQHC is unique. It's governed by a community board, so it's the patients actually get involved in the care. But you're right, in terms of the ability to pay, because we're federally qualified, we have to take you regardless of your ability to pay, regardless of the citizenship. Anybody who lives in our community, we have to support. The federal government does support some of that, but we have a sliding scale for folks. But you can have commercial insurance, Medicaid, Medicare, or self-pay, and come to, as you said, we are designated, and only about 23% of all health centers are designated as a patient-centered medical home level 3, which is a certain standard of care that is designated by the NCQA for exactly the things you had mentioned. We do patient education, diabetes screenings, all the various screenings to help improve the health outcomes of our patients. And thanks to NuHealth support, we were able to grow. I think at last look, we had 70 clinicians working, including residents, in our sites. And it was just, it's very impressive. And we've grown hours. So each one of the sites that we have now are open 2 evenings a week and Saturdays. So we're 6 days a week in all of our locations. And hopefully by the end of the year, we'll be open at least 5 nights a week in all the sites. So we're really pushing to make access to care as something as important as the quality of care we offer.
Yeah, and you do provide that. And just, for you yourself, and since you've been in this position, you've done so much for the FQHCs. You've expanded different services. I mean, dental services, podiatry services, behavioral health services. You're putting
just added that this year.
Yeah, you're putting all of that out into these communities, and people don't even know that they're out there. They're probably driving right by it, and they don't realize, oh, there's a medical building. Well, no, it's a federally qualified health center. That's a top-of-the-line medical facility that people could just walk right in or make appointments and receive soup to nuts care, the Cadillac care, if you want to call it.
We have a full electronic health record, and you are correct. We can get same-day or next-day services. Because we're certified by Patient-Centered Medical Home, we must have same-day available services. And when we talk about Cadillac, we have an electronic health record that, if you're so inclined, you can email your doctor. You can see your electronic medical records, and you can schedule an appointment online. So something I can't do with my personal doctor yet. So I'm going to have to switch. But we do offer some wonderful services to the community, and you're right. We've added a ton of things. Again, with the support of the institution, we have NuHealth doctors that rotate through our facilities. So it's a wonderful relationship. And we hope to grow that now and into the future.
So you mentioned patient-centered medical home a few times. What exactly is that, and how do you reach that standard?
So that is a national standard of approximately 150 different types of practice modifications that a medical office has to do, such as the connection with a patient through electronic means, such as the sending an email. They must have same-day services. One of the big functions, though, we talked about is educating our patients and trying to prevent chronic diseases. So we have a nurse care manager who will screen the panel the day before and see who has what conditions and prepare if they have diabetes or high blood pressure or cholesterol. We can work with them and educate them after their visit on various diet and exercise and quality healthcare things that they may not have time to sit down with their doctor about, and to really understand their quality of care. And these 150 measures really transform us to a team-based care and focus on the needs of the patient more so than just coming in and waiting for them to be sick. We may outreach to them and say, look, we know you have diabetes and you haven't been in for a while. We'd like to check on you and make sure things are going okay. Or if you're doing so well, maybe we don't need to see you as often because you've got it under control. And offer those services, nutrition, or a dietitian to come in and help you to control that diet. So it's really a much more comprehensive level of service that we've ever offered before.
Yeah, and it's really, you've achieved level 3, which is pretty much the highest
It is
level.
the highest standards.
And so, I mean, most physicians, private physicians' office don't even do that because they don't have the staff or the resources. And certainly the urgent care centers don't do that. Even hospitals now, we're trying to do that. We're actually working that model that you have put out into your clinics, into your facilities. We're trying to put that model now in the hospitals.
You do have that in one of your, in 2 of your sites, your pediatric and your adult ambulatory do have patient-centered medical home designation, and the working together has been great. But you're right, there's still a long way to go for all of us to get to where we really need to be for patient-centered medical care.
And if you look at the cost to healthcare, I mean, the majority of our costs for healthcare occur, most of the budget in the country, the great gross national product, a lot of that goes to healthcare, and we need to look at how to save money and to sustain programs like Medicaid, sustain Medicare for the elderly. And I think all of this fits that model where we get to the patient while they're healthy. and no longer is it sick care, right? It's wealth care, right? And you have all these these things that people are saying, it's value-based medicine, where it's not what we do or how many people we see. It's not the volume. It's what we're doing for those patients.
We have about 26,000 patients we care for. In 2014, we did about 97,000 visits. And you're right on target. If there's a way to reach out to them and help them be healthy, it's really important. This is also a cheaper cost of care, less costly as opposed to an emergency room visit and a hospital stay. It has been proven that FQHCs provide a high quality care at lower cost. There is some supplementing by the federal government, but in all, this is a much better alternative than having somebody go to the emergency room for something that was very preventable. And you and I both know that Nassau County has a high percentage of avoidable admissions to the emergency room department. So this is the proliferation of the FQHCs will help those high-need areas really to focus on health outcomes.
Right, and that brings to mind the five-letter word that we all have come to love over the last couple of months, and that's the DSRIP, the Delivery System Reform Incentive Payment. And that's a program where we're trying to do just that. We're on a large-scale hospitals statewide. We were giving funding by the federal government through Governor Cuomo's office and Department of Health to actually look at decreasing those avoidable and unnecessary admissions and trying to save some money overall and try to save the system, try to save the Medicaid, Medicare system that is costing so much money now. So how does the FQHCs fit into that DSRIP model?
Perfectly. It's actually really set up really, really nicely. And as you said before, healthcare costs a lot of money. I don't know, $3 trillion or something. And it's not focused on health, but really sick care. This is not focusing on health. So NUMC's, NUMC's 11 projects are really focused on the outpatient world and how to help prevent people from coming to the emergency department. And so the FQHC is partnering with NuHealth and NUMC to really work cohesively to ensure that one of the projects is to ensure care transition. So when you leave the hospital, and we don't want somebody coming back within 30 days. So we want to make sure we're seeing that patient within 3 to 4 days. And right there, getting on that. Another project is co-location of behavioral health and primary care. Every patient who goes through our health centers has what's called a PHQ screening, Patient Health Questionnaire, which is a depression screening. So we do 2 questions. If they say yes, it triggers it to 9 questions, which enables us to then work with a behavioral health specialist on site to focus on the behavioral health issue as well as the physical health issue.
Right, so you're not just working on the body, you're working on the mind, sort of a holistic pattern on top of an allopathic pattern. It's sort of the best of both worlds.
Yeah, so we hope to be a wonderful partner with NUMC to help facilitate the goals of really incentivizing the payment towards pay for performance, because that's what it should be about, not just pay fee for service.
So this DSRIP program, and we hear a lot about that in healthcare today, it's going to decrease admissions to the hospital. It's going to then help patients stay healthier. I know in the hospital, you mentioned the transitions of care. The model that you're performing right now under your patient-centered medical home, where you're following patients outside and calling them up, that's what we're trying to do now at NUMC. And we have a transition of care program that is actually patient navigators, patient care navigators, social workers, care managers, people that actually go out to patients' homes and visit them when they get discharged from the hospital. So NUMC is, right there. We're ahead of the curve on that, and hopefully we'll be able to get to these patients before they get ill and do something about it. And, get them over to see you.
I agree wholeheartedly. It's no longer is payers and the system okay with us waiting for you to come to us for care. Now it is behoove us to make sure that you're healthy, that we outreach to make sure that if we haven't seen you in a while, we connect you to care. And as you said, the care transitions, a lot of issues would happen in those immediate discharges from the hospitals. Very confusing. I don't understand what I should be doing. And having your staff there to navigate somebody through a complex maze of healthcare when they've gone through potentially a traumatic event is really reassuring and will help cut down on those costs. For a little bit of cost to an institution, it saves a huge cost for one, the person, and 2, the system. And it's a wonderful benefit, and for us to link to somebody, to our navigators in the health centers with yours, to make sure that we don't drop somebody along the way.
It's what we really want to do, and most people want to stay healthy. But it's hard to change people's behavior. The smokers, the alcohol, people who drive recklessly or don't do certain things. These are the standard behaviors that we really have to influence, and it's so difficult to change people's behavior. But I think by getting on top of them when they're leaving the hospital, and maybe just following diabetes and following, tell them, hey, you can't really have a Snickers bar, or something that may raise your glucose without covering yourself with the right amount of insulin. So yeah, maybe you could cheat a little bit and have birthday cake or a Snickers bar, but you need to know that you have to then cover yourself with the proper amount of medication. So all that education people don't have and they don't know, and we'll have people walking around Nassau County with extremely high blood pressures, on the verge of having strokes or heart disease, and people with high sugars and glucoses that could put them at huge risk for atherosclerosis and other problems. And by just coming in to visit one of the FQHC primary care locations, you guys are all over that.
Yeah, we're unfortunately in a tale of two counties. That's the thing put out by the Nassau County Department of Health, with a few communities that have higher risk needs, and for everything you had just said. So you offer it, NUMC, and we I think have a couple of groups out by us, diabetes support groups, just to help people understand what kind of education's out there. And you have hit it right on the head. We've got to help educate our public, help them understand what happens, what are their consequences to their actions, and focus. So we've got grants that we've worked with schools to focus on childhood obesity and to help them connect them to care at a young age, so that way they can learn healthy behaviors. Because you're right, changing behavior is really, really difficult. I could lose another couple of pounds, but it's very difficult for all of us in our busy lives to go and focus sometimes on our health care. And having something in your community accessible when you need it is a piece of that. But then for us to reach out to you, to really try to engage that community, is another piece that is changing the way healthcare looks today.
And National University Medical Center over in East Meadow, I mean, you see the hospital is a really big building, but most people don't understand what's going on inside that facility. I mean, a lot of people first experience with the hospital is a trauma center. They get into a car accident, they break their leg, there's some sort of emergency, a heart attack or so, and the ambulance will bring them to the level 1 trauma center, to the premier hospital here in Nassau County, which is Nassau University Medical Center. And they'll have a good experience. I mean, we have a brand new $38 million ER, state-of-the-art CAT scan right in the emergency room, which actually can take a picture of your beating heart to look at the coronary arteries to see if in fact there's a blockage. So for cardiac issues, it's got some of the best board-certified physicians, and we're changing the face of that hospital. We're putting in new services on a weekly or monthly basis that challenge any other facility in Nassau or even New York City. Whether it's in orthopedics with our total orthopedic group, we brought in some of the top orthopedic doctors that are there 24 hours a day, 7 days a week. Brand new neurosurgeons, board-certified neurologies. We have a labor and delivery suite that we just opened up that you think are in one of the 5-star fancy hotels.
Our patients love it.
The patients love it. I mean, it looks like a really fancy hotel room, but then all of a sudden the walls spin around, revealing all sorts of monitors and medical stuff. And when you're having your child, you're in that beautiful environment, and you stay in that room. You don't get rushed into another room, and you deliver your child in that beautiful setting. People love it. They really do. Next week, February 26th, we're opening up brand new intensive care units, an ICU intensive care unit, a medical intensive care unit, and a surgical intensive care unit, as well as a coronary care unit. And these are all refurbished, state-of-the-art intensive care units. So God forbid you get really injured and sick, and you come to the hospital and you meet the board-certified guys down the ER, and they're able to do their thing on you. We send you up to the ICUs, and now you're in a really great environment up there on the second floor in the intensive care units. And so that's the message I want. We want to get out to the communities, to Nassau. But the idea is if we could prevent that in some way, and that's what I think all you guys are doing out there in all those primary care stuff, to get these patients early and to intervene with them.
Sure. Get your physical every year.
Yeah, absolutely. And we talked about mammography. We have the mammography van.
Comes to all of our sites.
Goes to all your sites. And it's not just a mammography. It's what they call a tomosynthesis machine, which is a state-of-the-art. It's probably one of the most sensitive mammography equipment that's out there. I mean, most hospitals don't even have it. We have it not only in our hospital, we have one in a van, in one of these big mobile home things that go to your facilities.
Yeah, there's a site every week.
Yeah, and there's a site every week that a woman could go call your number and make an appointment to see to have a mammography, and it's life-saving. It's David, as well as I do.
Yes.
We catch countless numbers of lesions that we're able to intervene and save a woman's life. And there's nothing more important to us than to do that.
That's what we're here for.
Yeah. So how often are the vans at your facilities?
Typically once a week.
Once a week?
Yeah, I mean, we have 5 of them, so they rotate. So
How do you schedule something with?
just call our main number. It's 516-296-FQHC. And
296 FQHC.
QHC. And they
Yes.
will schedule an appointment. And
So-
just wherever they live. If they live in Westbury or Hempstead, from that, it'll get you, that main number will get you to any of our sites.
So that's FQHC as in Federally Qualified Health Center.
Yes,
Gotcha.
sir.
Gotcha. Just because sometimes it doesn't come off on the radio so good. So they can
Okay.
call that. Could they make other appointments with you there if they want to see a
Sure.
cardiologist,
Yeah.
if they want to see a podiatrist? How
Yes.
about dental?
Yes. 3 of our sites have dental. Our Freeport site, Elmont, and our Roosevelt site, and Westbury to come hopefully second quarter of this year.
So now, if say I want to go to the dentist,
Sure.
all right? I have a tooth that's bothering me, so I'll call you up. So I could just walk in, make an appointment, come in, and that
Sure.
dentist will see me like a regular dentist.
Correct. Yes. We have all digital X-rays at our site, so
Wow.
top of the line equipment, and we're looking to get a 360 X-ray at our new site in Westbury.
Wow.
So it's going to be really, really neat stuff. Fully electronically integrated, and we take most insurances. So you can just come on down and give us a call beforehand. Emergencies are typically the same day if we can squeeze you in. If you don't mind waiting a couple of minutes, depending upon the flow of the day. If not, we'll try to get you in the next day.
Even my dentist doesn't have digital.
Mine neither.
Digital X-ray. So, I mean, people don't realize that this stuff is out there, and it's paid for by the federal government, and it's for people, for anyone who's a resident in Nassau County, or to come in and make an appointment and do it. How about other services? What other services do you have?
Again, the big ones obviously primary care, but for pediatrics. So we've got pediatricians there. We've got the podiatry now is expanding at all of our sites. We have women OB care, as you said before. All of our sites have certified OB. A lot of folks have gone through NUMC in their training, so they've been integrated with the hospital. What else do we have? Behavioral health. So we've added psychiatry to one of our sites and a psychiatric nurse practitioner. But we have psychology and social work at all of our sites.
Wow.
So it's supporting that. So even optometry is now at 2 of our sites. Will be at Westbury come April, and right now over at our Freeport location. So we offer the specialty care, and as needed, we can reach out to our community and see what is needed. We can be either part of with the hospital or bring on a physician part-time to help with that primary care access issue.
How do people find those locations? Are you guys online?
They're on that. We're both on your website and ours. So for our website, it's just www.lifqhc.org. Very, very simple.
Long Island
Federally Qualified Health Center.
Right.
.org. Very, very simple. Or NuHealth. You have a link on yours as well. And they can find it online. They can even connect electronically, pull down some information on that, and connect to all the sites. So we're there for the community.
Can people go visit, say, Westbury?
Of
If I want to go to the Westbury facility, I can just go there and say, "Hi, I'm an interested consumer. Can I take a look at your facilities? Let me see who do you have working here."
In a heartbeat, you can come. We offer tours if people are interested. A couple of our sites have a consumer advisory board, so we meet with them probably on a quarterly basis just to get the feel from the community. What else should we be offering? And again, thanks to the support of NuHealth and the federal government and the grants that we apply for, we're able to invest those dollars right back into services of care.
So pediatrics, I could bring my child there, and they could start a chart on them, and they'll review the records from my physician.
All the immunizations, everything. We keep an electronic chart. We do a zillion school physicals every year. So whatever is needed, we can take care of that.
If I have my own pediatrician, would you communicate back and forth with that
pediatrician?
We
would obviously prefer to be your primary care pediatrician, but
sure.
if you had to for an emergency basis, we would definitely be able to communicate both electronically and also on the phone.
What are the hours? What type of hours do you guys
The hours vary by site, but most of the sites have typical 8:30 to 4:30. But now each site has 2 late evenings a week till 8 o'clock at night, and the Saturdays go from 9 to 1 on Saturdays. And as the need grows in our community, we'll expand further. So the hope is we'll be 8 to 8 by the end of this year in all 5 sites.
That's great, and that'll be for most services.
Yeah, it'll ensure primary care definitely, and secondary to that will probably be pediatrics. Those 2 services will be definitely the 8 to 8, and then we'll add on things like behavioral health, OB, dentistry has been added. We do have behavioral health now on the weekends, so we're growing those services as we bring on new clinicians.
How about special services, CAT scans, MRIs, something like that?
Most of those we refer over to the hospital. We do have an X-ray in all of our radiology in all of our sites, but that's managed by NuHealth. But for more complex care, that goes over to you over at NUMC.
And all our specialists. If there's a
Every
specialist that you need,
we refer all our specialists. We're electronically connected and fully integrated with NUMC electronically, which is also a rare feat. It took us quite a bit of time to do that, so we can send electronically all of our medical records to the hospital, so your specialist can see everything, alive and living color, not duplicate records, tests that needs to be done. They'll have up to the minute information on whatever the specialist needs.
no, that really it fits. It just fits like a hand in a glove. It works
beautiful
together very
relationship.
well. So, I mean, besides the doctors working together and the idea that you have all these backdoor resources, it just seems that the concept with the district model, where we're looking to keep people healthier, keep them from having to be admitted in the hospital, that you were ahead of the curve. You sort of thought of that about this before, and I mean you meaning FQHCs have thought about this whole concept long before we even initiated this, this whole district program.
FQHC is about 50 years old, and they're designed to do just what this is doing. Distrip is a wonderful arm to help us get from fee-for-service to, as you said, value-based care, to caring for a population of individuals to really keep them healthy and to be held accountable for that. So that's what I got involved in healthcare for, to really help an individual in a population stay healthy and provide preventative care.
And you mentioned accountable care. I mean, so now are we going to own populations? In other words, my hospital, and I'll be given a certain amount of money to cover all the patients in East Meadow, and if I keep them all healthy, I keep that money. But if I don't keep you healthy, I'm going to lose all that money.
It is a potential risk if we go down and start engaging in those type of accountable care organizations and have those conversations with payers. That would be a risk we could lose. But we could also reshape the way we deliver care and look at what's the most cost-effective way to do it instead of that being dictated to us to really help in getting better valued outcomes.
So in other words, get in front of this, figure out what we can do to work with the population in our communities to keep them healthy, number one. Number two, refer them earlier to primary care specialists to take care of stuff, do screening exams, and redirect patients so they don't need to go to the emergency room for every sneeze and cough and everything. They can go to a place such as yours, a federally qualified health center, and be seen and treated and hence not get sick with a pneumonia and have to be admitted.
Agreed.
So these avoidable, I guess that's what you mean by
Yeah.
avoidable admissions.
Sure. A lot of folks unfortunately come to the hospital just because of access, and it's after hours and they have a cold. So if we can do something that's really unique and learn over these next 5 years how to manage them out in the community, that's where we and they benefit.
Yeah, I mean that's exactly what we're trying to do. I mean, look, we have a real great emergency department. We have all board certified pediatric doctors. We have board certified ER guys waiting for you. God forbid there's something, we're here for you, and it's 7 days a week. The NUMC emergency department is there. But if you have something minor, what we're trying to say is to go to a primary care physician or a place such as yours to have those things taken care of. And we're going to have staff on hand when you get discharged from our hospital to follow you in your home to make sure you have those follow-ups, that you get prescriptions and things along those lines. Yeah, I mean, it's a really amazing time in healthcare. And people are saying that the DSRIP concept, this value-based care, this pay-for-performance model, is going to revolutionize healthcare here in America.
We'll see. It's a complex model that we're going to experience together, and I hope it does. But we'll see what happens.
So what's the future for FQHC? What do you see happening with you, David, now?
I see us looking at some other high-need areas in the community of us to potentially expand. Not only expand our hours, but expand the services into other communities. And to work on DSRIP and other projects like that to transform our care from fee-for-service to this value-based care where we're really looking forward to engaging a community on what they need in the most cost-effective method possible.
Well, you're doing an amazing job, and a lot of students in various universities around Long Island taking healthcare administration and all these other types of degrees, and they could really learn a lot from you and from what you've done in your facility and where you're going with this. So we can't thank you enough for being here today on the show. I mean, really, that's you're doing some really great work out there, and I don't think anyone even appreciates or knows that you're out there doing all this stuff. But
Thank you for publicizing.
yeah. And it's not just you. It's how many employees do you have?
All over between the hospital and ours, about 200 employees.
So about 200 people. So you have about 200 great people out there, real dedicated, hardworking healthcare professionals, saving lives. And that's really what it's all about, being a physician and being in healthcare is to do just that. So I just want to say thank you for all the listeners for being here this morning with us. Dave, you're a really great guest. You really gave us a lot of good information and really support what you're doing there. I'm Dr. Victor Politi. I'm the president and CEO of Nassau University Medical Center on Hempstead Turnpike in East Meadow. And we're always going to be there for you if you need us. Some of the best services, best doctors. But if you are feeling well and you're driving by, just wave. We'll wave back. Otherwise, have a great day and stay healthy.